Yeah, good evening, everyone. Welcome to Bristol University once again. Uh, Today, we shall be looking at a course unit on supply chain management in healthcare. By definition, we say supply chain management in healthcare is the process of planning, implementing, and controlling the flow of medical goods and services from point of origin to the point of consumption. The supply chain is like a psychological system of a hospital. It's a network of organizations that work together to ensure all the necessary medical supplies, medications, and equipment are available for patient care. It covers everything from acquiring raw materials to delivering healthcare services. So, what this point tells us is that when we talk of supply chain management, we are looking at the complete process right from the manufacturing point, actually. Right from the point of origin. Okay, this point of origin could be already the medical warehouses, but at the manufacturing sites. If this factory is not within the country, like case in South Sudan, and we are trying to procure medications from maybe a supplier in abroad, UK, India, whatsoever, that means the planning of all these supply chain of ours should take into account all the delays that we might encounter right from the point of production until the facilities it reaches the facility where the patients are able to consume it. So you will just definitely see that it is really not a simple kind of thing, because we have to factor out a lot of regulation, a lot of drug movement kind of regulations, including also transportation and uh, expected delays. So we have to factor this all into our existing stock, so that it is continuous and we don't have to run sort of supplies at our facilities. So it calls for a better uh, planning and coordination of supplies. Aims of supply chain management in healthcare. With supply chain management in healthcare aims to optimize the efficiency, the quality, the cost effectiveness of the healthcare delivery by ensuring that the right products and services are available at the right time, place, and quantity. Okay. So as I already explained, we have to make sure that these services are available at the right time, at the right destination, and also the right quantities that we need for the function of our facilities. Let's look at challenges of supply chain management in healthcare. Number one is a healthcare supply chain management is a complex, dynamic, and fragmented involving multiple stakeholders. We have all been in the health facilities, I guess, if not directly, but perhaps, yeah, in the management loop, you will still be able to encounter this. So, you know that indeed we have various departments that interact with each other in the provision of healthcare, and each department is really very important. What each and every department does is very important for the welfare and quality services provision to the patients. Okay, so it is something complex, and you need to make sure that there is synchronicity. This complexity should enable that all these different departments, though they are fragmented, should be able to work in synchronicity in a dynamic kind of pathway, so that there are no bottlenecks in between in regards to delivering the quality of care. We also have what we call product variability. Okay, so the point here is that sometimes there is a lot of variation in the products that we are expecting, and actually what we receive. So all these becomes challenges to already existing healthcare system. Regulatory compliances, you will always note that sometimes regulatory compliance changes from time to time. For example, in South Sudan, currently I'm getting quite a lot of issues relating to certain drugs that were initially not highly regulated, but because the government or the authorities realize there is a kind of misuse of these particular drugs, and then certain regulatory measures came in. Okay, you might be knowing, for those who had been in the healthcare practice, especially in South Sudan 10 years ago, you will have noticed that tramadol misuse was not an issue uh, 10 or 5 years ago, but in the last 3 years to date, you will always see that it is becoming an issue, and now the government is trying to come in with some at least control measures because the youths are getting to misuse this drug. Yet this was a drug that actually we don't have it as an over-the-counter drug. We knew it was only given under prescription to patients that are really in so much kind of pain. But those are certain issues that keeps on affecting our supplies, and we might it might reach a level where the regulation is so tight that even when we need to prescribe these drugs, sometimes we may not have enough because the balance between proper use and misuse is something difficult to regulate effectively. Challenges again, we say wastage of resources. Okay, so why we say wastage of resources? It is possible because sometimes we order more than what we need. Meanwhile, the utilization period in this particular point, maybe for a specific drug, may not go as planned. At the end, these drugs end up getting expired. Sometimes you see facilities or NGOs trying to run around with medications that they see are about to expire in 3 months or in 6 months, so that they are donated out. But many a times, these same drugs are the same drugs that even if it's taken to the other facilities, sometimes they are not in high demand. So indeed, it brings a kind of wastage because we might have procured more, and later on we don't have the diseases that patients present with for those particular cases. So it is something that always keeps us at a balance, but of course, this can be one of the challenges that we might be struggling to sustain. Demand constraints, okay, no enough patients. This one is almost, I almost linked up already with number 4 in the explanation. Okay, so no enough patients is like maybe for last year, we forecasted a demand that within this period for this year, we need to have enough of these drugs because last year we were in stock. But then changes happen such that we might have stocked more of these drugs, maybe based on projection of last year, but also changes happen this year. We don't have enough patients. Already is taking us to the wastage aspect. Processes constraints. We said slow care delivery. This one refers to where really the system is not effective enough to be able to deliver the supplies needed to provide the care as timely. Okay, sometimes we run to nearby facilities trying to request a few supply of drugs that we already ran out. Sometimes we get, sometimes we don't get. All those are already things that have constrained our processes. Supply constraints, not enough medical resources. Okay, so this one uh, goes to what I almost already explained. Here we are looking at the medical supplies. Okay, we don't have enough of them, and it affects the whole process. Benefits of healthcare supply chain management: it improves patient care and satisfaction, reduces operational cost and wastage, enhances resource utilization and productivity, and increases visibility and transparency. Okay. Sometimes, obviously, if we we have a better supply chain management and we have enough stock and all these, people can see exactly what really the facility is doing. You see supplies arriving, everyone is happy because this is something for improving the quality of care. So that is how it translates as well to transparency. Supports innovation and value creation. Components of healthcare supply chain management. So we said there are basically four components. One is the sourcing. We shall explain about sourcing in the coming slide. And then the procurement, and then the logistics handling, and then the distribution. So sourcing refers to the process of identifying, evaluating, and selecting suppliers of medical products and services based on criteria such as quality, price, availability, reliability, and social responsibility. Okay, so in sourcing, already we start to think, okay, we have our facility, we are going to have this project, we are going to provide services to our patients. How are we going to get medication? How are we going to get all the supplies that we need? So you have to think of identifying, okay, and selecting suppliers. But then you will also need to make sure that really the supplier you are selecting will really be able to provide these services based on the criteria that you need. Okay, the quality, the price, availability, and all those kind of things. It might even involve a bidding process. If you like, we already discussed about it last week about the bidding process. Procurement refers to the process of ordering, purchasing, and paying for medical products and services from suppliers according to contractual agreement and specifications. Logistics refers to the process of transporting, storing, handling, and traveling medical products and services from suppliers to consumers using modes such as air, sea, road, and rail. So we can see that logistics is really a very broad term that encompasses the transportation from maybe the manufacturing site, warehousing. Also, it involves storage because as we are transporting, we don't take these things really in one day to our health facility. They have to go through series of regulations, international, national, so set up the national stores, medical stores first of all, and then before going to maybe the state medical stores and then to the counties and then it goes. So all this will be part of already logistics handling. Okay. We said healthcare logistics is like a well-organized delivery of patient care. It involves management of moving medical materials, equipment, and information, okay, from one place to another within the healthcare system. It's about making sure everything gets where it is needed when it is needed. This has to be done timely. Otherwise, if we procure medications lately, it will arrive late from the international order. Once it reaches the country, medical stores, we have to act also quickly to make sure we have enough means of disbursing these medications to the consumption units. So all this needs to be done timely to meet the needs of the facilities down there. Components of healthcare supply chain management. Distribution refers to the process of delivering medical products and services to the end users such as hospitals, clinics, pharmacies, or patients using channels such as direct shipment or third-party logistics or last mile delivery. So here already perhaps we have the medications within the national central pharmacy, and then we need to make sure this one reaches to the states as quick as possible and then to the counties, to the clinics or pharmacy whatsoever it is. So here we said either we can use direct shipment or third-party logistic or a last mile delivery. This is where sometimes we see what really works quickly to be able to reach these particular medications to the last destination. For example, in South Sudan, we have areas that's a bit challenging logistic wise. So you think of alternatives that can make these medications reach there as soon as it is needed. Stakeholders in healthcare, supply chain management. So these are the stakeholders. Okay, we have the hospitals, can be the clinics, can be the pharmaceutical companies. Also, the regulatory bodies are always part of this, right from the entrance point at the border in Nimule, or whichever, or even within on arrival. You might have seen that once the medications arrive, always there are authorities that come and check on arrival. We have also the manufacturers, and then the distributors or providers, and then the payers and the patients. Okay, the payers and the patients. The payers are all of us, the consumers. A role of healthcare providers in uh, healthcare supply chain management. We said the healthcare provider, often a hospital, plays a critical role in the healthcare supply chain. It's like the central hub that directs how information and medical supplies flow within the system. So the hospital is at the center, okay, between the supplier and the consumer. So it keeps the balance, linking the suppliers and the consumers. The smoother this communication, the better the supply chain performs. So it is really upon us in the hospital to see that we keep this balance very well, because the patients are waiting from us and they always want to be sure that we are doing our best and we have everything they need. For the suppliers, at the same time, they're also waiting from us to see that we are able to come timely and buy the things for our normal running. So everything is centrally upon us at the hospital level. Okay. Healthcare providers are the ones who interact directly with the patients. Let's look at vertical integration in healthcare. We said vertical integration means a hospital or healthcare system owns the multiple aspects of its supply chain. It's like a hospital saying we want more control over our medical supplies. If they own the companies that supply them with the medical equipment, we call it backward integration. Or the pharmacies that dispense their drugs, we call this one forward integration. So these two forms what we call the vertical integration. So basically, what vertical integration in healthcare means is that, as we already saw in the previous slide, the hospital is at the center, okay? But really, if we need to function better, we need to integrate these functions very well. We can make a better integration to make sure that we and the supply team from the manufacturers are already aligned in a better kind of coordination, such that there are no bottlenecks. So some hospitals can even already own the supply system right from the manufacturers. Okay, so if a hospital is having that kind of arrangement, meaning they have already integrated backward, they have already made a backward integration where the supply between the manufacturer to the hospital is already well integrated. Okay, and then the next point is how fast are these supplies being consumed. Okay, are the patients getting the drugs? Is it timely? The dispensing, is it going as planned? Sometimes we can also integrate this, and I think this is what most of our hospitals do. Most of our hospitals here own the pharmacies. Actually, they dispense the drugs, so they have the power integration. Even the clinics. So here, well, we have the power integration, but the challenge will be that we need to keep these supplies, to be constant for the needs of the patients. Not like sometimes we go to our main hospital and then, yeah, the pharmacy lacks most of this, and then you have to go and buy from outside. There's already an integration, but that means there's a challenge with keeping the supply as needed. Reverse logistics in healthcare. Reverse logistics includes handling items that need to go back in the system. This often involves returning defective medical equipment to the manufacturer for repairs. It's also about reusing and recycling materials and supplies. So reverse logistics here is like, for example, if we receive supplies that we feel that needs to go back, especially when we realize maybe this drug needs more kind of quality testing. Okay, this can still go back, though it rarely happen. But with vaccines, we also have this, and also with some samples handling, we can have some reverse logistics in healthcare, where instead we have samples that are taken from the field need to go back to maybe a, a testing laboratory that might be even outside the country. And if this is a sample that needs to go in a kind of a cold chain kind of thing, then that means we need to already make a kind of reverse cold chain, maintaining a reverse cold chain, meaning if this one requires a temperature storage that is equivalent to most of uh, the conditions, like most of the vaccines we have, their temperatures for transportation are between 8 degrees and 2 degrees, but even some samples like serum, sometimes we transport them in temperatures of minus 40 degrees, minus 60 degrees. So you will have to organize a reverse logistics where you have to transport this sample in ice packs that are minus 60 or minus 80, depending on what you're transporting, from the field to your central store, and then international flight, and then up to the testing laboratory abroad. So this reverse logistics works both for items, but as well also for samples, especially involving cold chain management. Insourcing versus outsourcing in healthcare. You say insourcing in healthcare means the hospital or healthcare system provides its own medical services or produce its own supplies. This is interesting. It might not be the case with our setup here so far in South Sudan. Outsourcing is when they rely on external suppliers. This is exactly where we belong, which can sometimes be more cost effective. This is the advantage, because you only order for what you really need. As long as you are able to sustain this supply well, it is really going to be cost effective, because you only order for what you know is being consumed accordingly at your facility. This one can have a big impact on patient care and also the cost. Agile healthcare supply chains. Okay, these supply chains are made of organizations that can adapt rapidly. Okay, agility, speak adaptation, share information, and work well together. They are perfect for handling unique or rapidly changing medical needs. We look at the lean healthcare supply chain system, which we previously talked about. We say the lean supply chain in healthcare are like organizations that avoid wasting anything. So always lean healthcare models aim at avoiding waste, okay, and maximizing performance. They choose partners who are good at reducing cost and minimizing excess medical supplies. They also work to eliminate any steps in the process that do not add value. Okay, so this is value oriented to the patient care. Vendor manage inventory (VMI) uh, is like here we are giving an example. We said the VMI here is like a smart fridge that orders food when it's running down. So it's like an automated kind of thing, you know. Medical supplies use information from hospital to restock their medical inventory when needed. So basically, what we do is we have always our stock cards in the pharmacies. Why we have those stock cards? Because even the pharmacy attendant will be able to know that we are very soon going to run out of this specific drug. Okay, so before it goes out, there's a communication. Maybe the pharmacy manager informs the logistic manager, and then we can think of all this timely. Okay, what will be our lead time? We have this maybe we have this number of tablets remaining for now, and we are ordering. We are putting an international order. What will be our lead time? The time from giving an order until we receive this particular medication. How long it will it take? And then we start to factor all this, and then we place a kind of inventory. So why we need to be a bit vigilant is that always monitoring the consumptions help us know how fast we need to put orders so that we don't run into stock lapses. This coordination reduces costs and ensures that the right medical products are always available. There's what we call G2 in healthcare. In healthcare, G2 is like having a specialized expert from suppliers working directly with the hospital staff. This expert knows everything about the medical products their companies offer, making the supply process more efficient and patient focused. So here instead we are getting a backup from from a supplier who is directly dealing with us in the hospital. Already this is someone who knows who they supply us and they know our demands and also they know uh, how the production process makes. So this one adds a value to make sure that there's a better coordination of our supplies between the suppliers and the facilities. Quality care SCORE model. We said the SCORE here stands for Supply Chain Operations Reference Framework. Model which can be used in healthcare to measure how well the supply chain is performing. Okay, so this is a quality assurance kind of measure to detect how fast is a framework, how efficient is our supply chain system. It includes metrics like timely patient care, cash flow management, order fulfillment times, and the number of days worth of medical supplies at hand. So you see all this. Um, is the is the medication receipt for the patient care. Okay, how about the cash flow management? Because we need cash in between. When we place an inventory order, we need already money that should be approved for us to go and procure these items. If they are procured locally, well and good. But if it's an international procurement, then that means we need to have enough time for that. Okay. uh, Order fulfillment times, and then the number of days worth of the medical supplies at hand. Global impact on healthcare logistics. Just like other industries, healthcare has been impacted by global competition and trade. We might have seen what happened during COVID-19 and supplies of medical, even non-medical items in between countries when we saw when the lockdown happened. Hospitals now need to think about how to get medical supplies and expertise from all around the globe. Collaborations and partnerships in healthcare. We said collaborations in healthcare is like forming partnerships between hospitals and other healthcare organizations. So what happened these days is that some hospitals already work in collaborations, in partnerships. This is simply because uh, they gain a lot of mutual benefit because one hospital or might have certain services that one or another hospital is not offering, and by coming together in those kind of collaborations and partnerships, it makes easier coordination and even a better management of patients care in between this organization. This alliance help provide better and more efficient patient care by focusing on core competencies. Strategic alliances in healthcare operations. Strategic alliances in healthcare allow organizations to specialize in what they do best. Okay, here we have the specialist units. So indeed, these specialist alliances helps a lot because patients come with various presentations and they need to be attended with the highest specialist level possible if we can. So many a times patients come to the facility not knowing how uh, where they should have gone, who they should have consulted with this kind of presentation. But it is as the health professional to say that okay, this is perhaps a case that, for example, a case of somebody presenting with some psychiatric needs. Not anybody can be able to attend to this. The best is we need to send to specialized psychiatric services. Somebody coming with needs of surgical procedures, the best is this person need to get this kind of treatment, not from a physician. Should be referred to a specialized surgical center. So all these kind of alliances at the end enables improve patient care because already we are able to coordinate patients to the quality they need. Otherwise, many a times they don't know and they get lost, and it is our role to direct them to get these better qualities of care. Hospital can team up with partners who excel in specific areas, improving patient care and overall healthcare system. Okay, we have come to the end of our presentation. Thank you so much for being with me, and we meet in the next lecture. Bye bye.